Hi, I'm Dr. John Young here at Foundational Health Center here in Largo, Florida, and we're talking about Parkinson's disease, and this is part 2. The good news. So, Parkinson's disease is a deadly disease, and one of the signs of Parkinson's is when they do a CAT scan and they'll see deep inside the brain something they call Lewy bodies. And Lewy bodies is just a large aggregation of a protein called alpha-synuclein protein. And this is the key protein in Parkinson's disease. Because what's happening at the nerve ending is this protein, be it because of genetics or environmental causes, pollution or whatever, somehow gets misfolded and it starts to attack the nerve, removes the myelin sheath, which is where the potassium channels are that determine the electrical charge of the nerve, and then destroys the nerve. And as you destroy the nerve, you cannot make dopamine, which is the real problem of the disease. So the drugs really don't do much because they lose their effectiveness over time. So we started looking at what can we do to actually get rid of this synuclein protein. And there's a lot of things out there that you can do, because if you can get rid of synuclein protein, you can start a healing process. What we use at our clinic is we use umbilical cord stem cells and exosomes. Exosomes are specific for reducing synuclein protein. The stem cells help repair the myelin sheath along the nerve, repair the potassium channels, and restart to rebuild the actual nerve. And then they can also start to repair the cells in the substantia nigra that are also involved in producing dopamine. Now, when you do that, you can only do stem cells so often because it gets to be rather expensive. So we will add a drug that they use in MS, multiple sclerosis, and when we use that drug, it also reduces synuclein protein and helps the nerve regenerate. And it's been really exciting. I just saw 3 of my Parkinson's patients recently. All 3 of them completely different. One guy saw he could barely talk, just shuffled, hallucinations. After 12 weeks, this guy completely with it mentally, no signs of Parkinson's disease. So the other 2 patients were the same way. So the good news is this: you can get better from Parkinson's disease.